Arcuri.
Thank you, Mr. Chairman, Ranking Member, and members of the VA Subcommittee on Health. I first wish to thank you for scheduling this legislative hearing today and inviting me to speak on H.R. 3441. This legislation would automatically enroll veterans who are already eligible for free VA health care into the VA system while providing a chance to opt out of the system both at the time of separation from the armed services and 6 months following. My bill references the statute passed in FY08 National Defense Authorization Act. As you know, this law extends the eligibility period for free VA medical care from 2 to 5 years for veterans who served in a combat theater of operation after November 11, 1998. It applies to active duty National Guard, Reserve, and servicemen returning from Operation Enduring Freedom and Operation Iraqi Freedom for conditions that may be related to their combat service. Following this initial 5-year period, these veterans may continue their enrollment in the VA healthcare system, but they may be subject to applicable copayments for non-service connected conditions. My legislation takes the same group eligible for free health care under FY08 Act and instructs the Department of Defense in conjunction with the VA to automatically enroll these veterans in VA health care should these veterans so choose. This bill does not create a new class of veterans eligible for free VA health care, but simply changes the process by which these veterans would become part of the system upon separation from the DoD. Importantly, this bill includes an opt-out provision at the time of separation and again at 6 months after separation to preserve the veteran's right to choose his or her own health care. This bill would also issue a standard VA Veterans Identification Card to an auto-enrolled veteran and provide a listing of VA medical facilities within 100 miles of the veteran. It would also require the VA to attach a description of federal veterans benefits and programs such as educational benefits, job training, and placement programs for which the veteran may be eligible. The reason we are proposing this legislation is to make sure that acceptance into the VA is as simple and effortless as possible for the tens of thousands who will likely seek access in the coming months. Most of us here recognize the VA's efforts to track down veterans weeks and even months after their return. Yet, unfortunately, we still have a system that doesn't sufficiently reach all soldiers. It places responsibility fully on a soldier who has just returned from war and must step back into his or her normal life. Dealing with this single experience is difficult enough. We shouldn't place another burden on our veterans by requiring them to actively pursue the care they may want or need. The opportunity to improve our present VA enrollment system is reflected by the sheer demand of returning service members who are accessing the system at record rates. The VHA Office of Public Health reported this January that between FY02 and last quarter of FY08, 42% of the roughly 950,000 separated veterans have sought VA health care. The report also predicts that the percentage of veterans receiving health care from the VA, as well as the percentage given any type of diagnosis, will tend to increase over time as these veterans continue to enroll in VA health care and develop new health problems. Clearly, the demand for VA care will only continue to grow in the coming years. Unfortunately, these higher enrollment numbers also indicate a trend toward more cases of joint and back disorders, mental disorders, and what the VA characterizes as symptoms, signs, and ill-defined conditions. These three categories are what the VA has determined the most common health problems of war veterans and represent our collective responsibility to improve our delivery of good, efficient care to all those who risked everything for this country. Let me first say that I acknowledge the outreach efforts that the VA has performed during this time. An extensive outreach effort has been developed to inform veterans of their benefits, including the mailing of a personal letter from the VA Secretary to war veterans identified by the DoD when they separate from active duty and become eligible for VA benefits. These efforts have undoubtedly contributed to the higher VA enrollment rates. Yet while the VA attempts to reach out to returning soldiers and educate them about available resources, it is still presently incumbent upon the veteran to initiate and complete the application and registration process with the VA, and we know that some veterans fall through the cracks. In many cases, a soldier's primary focus during his or her last few weeks of deployment is simply getting back home, not spending more time away from loved ones by studying the VA application process, filling out paperwork, and undergoing evaluation. These service members often forego necessary screenings or care, leading to the critical situations weeks or months later when the symptoms begin to manifest or intensify. I commend the VA for its commitments and its efforts to reach each veteran. However, I see a chance to change the system so the veteran care can no longer centrally involve tracking down those who we've missed, and no longer leaves many veterans finding themselves months or even years later without proper treatment. By implementing the auto-enrollment and accepting returning soldiers at the outset, this bill would allow the VA to shift time and resources away from tracking the follow-up and instead focus on delivering health care right away. I thank you again for holding this hearing on my legislation to provide auto-enrollment for veterans returning from combat zones. This bill is endorsed by the American Legion and the Iraq and Afghanistan Veterans of America. I look forward to working together to honor and protect our veterans, and I would be happy to answer any questions you may have on this bill.